Hi, I'm Danielle, one of the Prolotherapists at Carey Medical, talking today about shin splints and another treatment option for those of you suffering from chronic shin pain. Often, this is a condition that affects runners, though it could affect anybody from any athletic background, where people often complain that they get really bad, maybe burning, aching shin pain in the front of their shin from their knee to their ankle when they exercise. A recent patient just described this as kind of, like I said, a burning ache that happens during running to the point where at the end of a run, they can barely stand. It hurts so bad, they're in such agony. And this is really a common description of shin splints. Oftentimes, patients might try icing them. They may try anti-inflammatory medications, maybe even just taking, 6 weeks off of running. Some patients may even spend, hundreds and hundreds of dollars on shoes, trying to, see if a different shoe or a different cushion helps. And in patients that have done all that, they've tried the rest, they've tried the ice, the Advil, the shoes, nothing is working. There actually is another treatment option for shin splints, which is prolotherapy. Prolotherapy actually is an injection technique that will work to stimulate repair of injured tissue. And when it comes to shin splints, what often happens is, because it's not an actual joint like a shoulder or a knee, what actually happens is that muscle attachment to the bone, you actually get kind of small micro tears in that muscle and that attachment that for some reason they don't heal on their own, and oftentimes things like ice and anti-inflammatories actually shut down the healing cascade and can actually make it worse long term. What prolotherapy does is, like I said, we do injections actually to those attachments, at that muscle and so forth, to really target that body to heal that area, to send growth factors and stem cells and all that good stuff that we need to make new healthy tissue and actually help to get rid of that shin splint pain. It's not something that necessarily happens overnight. The patient too is also put on a rehab schedule. It's not that you can just get prolotherapy and go run right away. Usually we kind of have them follow some kind of schedule where they run, walk, run, jog, just kind of do little intervals to kind of build back up as that tissue is healing. And after several treatments, these runners that we see are usually back to where we need to go, continuing training, continuing to run races and do very well.